In this video, I want to highlight 4 lesser known but serious complications of diabetes. Do you know all the complications of diabetes? Why don't you list them all down and see whether your list include all the 4 lesser known but serious complications of diabetes that I am going to highlight in this video. Hey guys, welcome to another episode of the Habits Doctor's Pharmacy, your go-to podcast for information and inspiration to start taking action to unlock the power of habits as medicine to prevent and combat lifestyle-related chronic diseases. I am Dr. Chan, your host. So, have you listed down the complications of diabetes? If not, I shall give you another chance to do so, even if you do not have a pen and paper with you. You can do that in your mind. List down all the complications of diabetes that you can think of. Done? Okay, does your list include lower limb amputation or kidney failure? From my experience talking to people and coaching patients with diabetes, these are the top 2 complications of diabetes that most people would highlight whenever I ask them to list down all the complications of diabetes. These are the 2 complications of diabetes that most people are familiar with, perhaps because most people have seen family members or friends with diabetes having to have their lower limb amputated or having to go for regular kidney dialysis because of kidney failure. But did your list of diabetes complications include heart attack, stroke, blindness, and dementia? Because these are the 4 serious complications of diabetes that surprisingly many people do not know about. Whenever I give talks, lectures, or do coaching sessions, and I list down the complications of diabetes, I often get people telling me that they did not know that diabetes increases the risk of developing heart attack, stroke, blindness, and dementia, or at least it was not something that they had given much thought about, nor paid much attention to. This may be surprising to many of you, particularly to those of you who are aware and who have included these 4 complications when I challenged you to list down all the complications of diabetes that you know. You might therefore be surprised when I tell you that through my work, interacting with thousands of people with diabetes through talks, workshops, and coaching programs, that there are still a significant percentage of people with diabetes who are not aware of, nor are paying much attention to the fact that people with diabetes have a higher risk of developing heart attack, stroke, blindness, and dementia, especially if their blood sugar control is poor. I wanted to do this video to highlight these 4 lesser known but serious complications of diabetes because it is important to educate people with diabetes that combating diabetes is more than just about achieving good blood sugar control, whether through medications or lifestyle change. And to highlight that combating diabetes is really about preventing and combating the many serious complications of diabetes, including these 4 lesser known but serious complications of diabetes: heart attack, stroke, blindness, dementia, through lifestyle habits change and optimization, diet, exercise, sleep, and stress management. Combating diabetes effectively starts with learning the essentials, equipping oneself with the must-know of diabetes management, including and especially the complication of diabetes, then followed by lifelong doing, the jump starting off, and the lifelong practice of healthy lifestyle habits to keep all the many serious complications of diabetes at bay. As always, work closely with and consult your doctor before embarking on any new significant dietary changes or starting on any new exercise regime, especially if you are on diabetes medications. You can find links to some relevant scientific studies and articles related to diabetes complications in my blog post on this subject. Link in the show notes below. Combating diabetes is more than just about achieving better blood sugar control. It is about preventing and combating the many devastating complications of diabetes through lifestyle habits change. Go learn more about it. Attend a course or join a program or speak to your doctor, your diabetes educator, or your health coach. Do whatever that you are willing and able to do to learn more. And most importantly, do more. To unlock the power of your lifestyle habits as medicine to combat diabetes holistically and optimally. It is easy to feel a little overwhelmed sometimes. Don't. Just take it one step at a time. If you think having a regular dose of bite-sized information and inspiration to support you in your journey to unlock the tremendous power of lifestyle habits as medicine is helpful, you may want to sign up for my Habits as Medicine newsletter. Go to www.habitsmed.com. I hope you have enjoyed this bite-sized episode of the Habits Doctor Pharmacy Podcast. I'm Dr. Chan. Let habits be thy medicine. Let's unlock the power of habits as medicine. One habit, one dose at a time. Take care.